as of now, and will be made available through the California Ambulance Association after the fact. This webinar is accredited for 2 NAC CEUs. Certificate will also be made available to attendees. A copy of the slide deck will be provided. I'll be dropping it in the chat for download momentarily, along with some other resources throughout the webinar. All links in the deck are live and clickable in the PDF file. If you have questions for the ACE faculty during the webinar, please use the Q&A box to submit those so we do not lose them in the chat box. The Q&A box is the double bubble box located near the chat box. Please use the chat box for any technical assistance needs. And I will also be dropping some resources into the chat box for download throughout the webinar today. With that, I'll turn it over to Donna Hankins, Director of Billing at American Ambulance, CAA Payer Issues Committee Co-Chair, and ACE faculty member to get us started. Donna?
Well, thank you so much. And I also want to extend my thank you to Moss Adams for helping the California Ambulance Association host this webinar. We made this webinar complimentary because we definitely are concerned and want to help everyone report on their cost reporting to CMS this year. I want to also thank the ACE faculty for letting me join. We have some amazing people on the faculty, and I'm so excited to help them present this information. Today, the faculty joining us are going to be Michelle Anderson, who's a AAA Workforce Committee member, and she's the Director of Administration at Lakes Region EMS. And also we have Scott Moore, who's a AAA HR and Operations Consultant, and he works for Moore EMS Consulting. So we've got 2 great people to help me walk you through cost reporting. Before we do that, of course, we have our disclaimer. The American Ambulance Association and its consultants and speakers do not provide legal or accounting advice. We really recommend you get your accountants and your financial advisors, and in some points your lawyers for some of these questions, to make sure you understand what you need to report and how to report it. This material is for informational purposes only and shouldn't be relied upon for legal, tax, or accounting advice. So make sure to consult your people. First thing we want to talk about is, why is cost collection critical to EMS? We've been hearing about cost collection for the last 3 years now. Why do we want cost reporting? And the answer is, of course, to reform reimbursement for EMS agencies. We are, as we know, severely underfunded. And how do we fix that? We let CMS know. How does CMS collect that information? Through the cost collection tool. If we can get better reimbursement, we can also open the door to innovation, things like treatment in place and telehealth, better dispatching services. Important steps to our evolution are here for cost reporting. There are some problems that we're trying to solve. We all know that we have below cost reimbursement and in-network pressures. Some people don't understand our value and how we work. People don't understand that we're a mobile integrated healthcare and that we need funding. We're not recognized as a safety net. If we're not recognized as a safety net, they don't understand why we have to be paid the fees that we're paid for the services that we respond to. And the services that we provide have high costs. Our drugs and our emerging technologies are hard to implement because of the cost for those that are not reimbursed currently. So all of this relates to, how do we improve our reimbursement? We implement the cost reporting system. So we're telling you why we need to do it, but what if you don't want to do it? That's always a question that comes up. For you personally, as an organization, if you fail to participate in the cost reporting, you will be hit with a 10% fee by Medicare. Medicare will reduce your reimbursement by 10% if you do not participate in cost reporting. Secondly, though, if we don't have our providers join in on cost reporting, it's going to jeopardize our Medicare add-ons. We have been telling Congress for years we need the urban and the rural add-ons for our reimbursement, as well as increases in reimbursement. And if we don't participate as an organization in cost reporting, if all of us don't, including the little providers, we're not showing truly the cost of ambulance reimbursement. So we all need to participate, not just because of our 10% tax cut, our reimbursement cut you may be hit with, but because everybody needs to report. If we don't all report as an industry, then it could decrease our overall fee schedule and we may lose out on innovation. So just be aware that cost reporting may seem like a large hill to climb, but if we don't climb this hill, we're not going to get to the top of that hill and see better reimbursement, which will lead to better innovation. Let's talk about the cost collection timeline. As all of us know, we had a great timeline for cost collection, a 4-year system, and then COVID hit. And so we've now squished that timeline together. In January 2022, if you were selected for year 1 or year 2, both year 1 and year 2 are reporting together. So you're reporting together for year 1 and year 2 if you were selected in January 2022. You're going to be collecting that data and reporting it by May of 2023 or later, depending on your fiscal year. But you're going to have, you're going to be ready to report in January of 2023, hopefully. If you weren't selected for years 1 and years 2, that's great news for you. But the bad news is you will be selected for year 3 and year 4 to report in 2023. So basically 50% of the providers were selected to report in 2023, and the other 50% are being selected to report in 2024. So you're in 2 camps. Either you were selected for cost reporting and you're trying to figure out how to do it, or you will be selected and you will be figuring how to do it very shortly. So it's very important that you're attending any cost reporting webinars, live events, discussions that you can, because you're going to have to report either for 2023 or for 2024. Once we get all that reporting together and reported to CMS, they're going to release a MedPAC report to Congress that will analyze the costs of ambulance services. So understanding that you need to do it, understanding when you're going to do it. The next piece is, how do I do it? And there are some great resources. The AAA has worked really hard to provide some resources for you. There's a free cost collection newsletter. That's at ambulancreports.org. So you can go to that website, sign up for the newsletter. We have these Ask the Experts. In addition to these webinars, we have where you can email us and we can answer questions that you have as you're going through your cost reporting. AAA has developed the Amber cost collection software for EMS and for fire in order to help you collect your data using the same logic that CMS's cost reporting instrument uses. We have that available. We have on-demand webinars that are available. You can request a speaker to come to your event, or we can do a webinar like we're doing here with the California Ambulance Association. And then you can also host a workshop at your facility. If you have friends and neighbors who need help with the cost reporting, we can help you host a workshop. One of the great tools that have been developed is Amber. Amber is developed based on the CMS cost reporting toolkit. It has what we call built-in error checking and what we call skip logic. So when you answer questions in the first part of the cost reporting, it's going to go ahead and eliminate questions you don't need to answer and help you through it. So it's a good idea to sign up for Amber. The great news is Amber is included in the AAA membership if you're a AAA member. If you're not a AAA member, the SAVIC Foundation has very generously given a grant to help you get the Amber software. So you can work with the SAVIC Foundation to get a grant in order to access Amber. Basically, what it means is you get a AAA membership through SAVIC. AAA membership gives you access to the Amber software, but it also gives you access for that year to the AAA resources that you might want to take a look at. The other resource you have available is, of course, directly from CMS. CMS is the one who is collecting all this data, and they do have resources for you. They have the Medicare Ground Ambulance Data Collection System report. It was updated January 1st, 2022, or January 7th, I should say. So if you downloaded that cost report from CMS when you were selected for cost reporting back in 2018 or 2019, make sure you go and get that updated report, because they did update it and answer some questions for 2022. So before you start your cost reporting, go get that updated PDF. There's also resources at the website. There's a zip file of the data, who was selected for year 1 and who was selected for year 2. And we expect at the same website, they're going to have the year 3 and year 4 coming up. Our expectation is they will probably report year 3 and 4 by the end of this year. So by the end of 22, we should know who's selected for years 3 and 4. And finally, let's talk about the cost ambulance data collection instrument itself. So the instrument is a document you can read over. It has 13 sections for you to go through. I like to break this apart into 4 different parts, just so I can break apart this big beast that we call cost reporting and understand it. So in my head, I have it in 4 parts. The first part is the preparation. You identify you've been selected, you panic, you go get the cost reporting instrument, you identify somebody who's going to handle cost reporting. That's part 1. Part 2 is collecting your data demographics, and that might actually be done at the beginning of cost reporting. Sections 1 through 5 are all about the demographics of your agency. So you're not reporting too much of cost information there. You're more reporting to CMS, who am I as an organization? That's parts 1 through 5. Part 6 through 12 will be your costs. And so that will be part 3. Part 3 will be all of the costs that you're going to report. It's broken up into different categories to help you organize it. And then, and last but by no means least, part 4 is all about your revenue. So if you can imagine this in the 4 different sections: 1, preparing; 2, reporting your demographics; 3, reporting your costs, and 4, your revenue. It's kind of easy to break up and kind of helps you if you are the cost reporting lucky selectee from your organization to handle this. You kind of know how to break apart your information to take care of it. There are some common areas of confusion that we've seen again and again as faculty about what do we do about certain sections. And so as we go through those sections, we're going to highlight these common areas of confusion to help you know what to do. For example, your position, the employee position at the start of the collection period, if an employee is promoted, what do we do? We'll cover that. That's a common area of confusion. The definition of an EMT responder versus administration staff for your labor, we're going to cover that. Scott's really got a handle on how the labor works. He'll talk about that. And the time on task and the response times have some confusion areas, and we'll talk about those. And then shared expenses. If you're not just a ground ambulance provider, but you share expenses with maybe fire, public service, or air, how do you report those? We'll talk about those as we go through this cost reporting. So let's get into this. Let's start talking about how we do cost reporting. And section 1 is your general survey. It talks about who you are as an organization. One quick thing to think about here is you might have multiple NPIs at your agency, but the CMS cost reporting is not broken up by agency, it's broken up by NPI. So if you have multiple NPIs, make sure you're reporting on the NPI that was selected in that cost collection period. So we think, based on estimation, it's going to take you 20 hours to review the instructions, collect the required data, and 3 hours to enter and review and submit the information. The great thing about Amber is that you can enter information as you collect it, so you can stop, start, go back and forth, and you can see where you need to enter data. But we want you to make sure you put aside about 24 hours or more for the cost reporting. We also want to make sure everybody understands when we talk about ground ambulance organization, we're referring to that NPI, and we're referring to your ground ambulance transportation and their costs and their revenue. And also to make sure you know that this organization-specific data will not be published. This is for CMS's information only, so they understand what to do, and Amber won't be publishing this as well. When you're working on your cost collection, you're going to be talking about your organizational characteristics. You're going to need to set up for CMS, report to them the answers to these questions, and it will set up the rest of the cost reporting. So for example, if you report that you're a fire agency, you may be reporting site information. So it's important you do your data demographics first, that first section, do that first in order to set up the questions moving forward. You're going to be letting them know your organizational contact, your calendar for your fiscal year, what type of business you are in the organization, a for-profit, nonprofit, government, or public or private entity. A lot of these questions you've already answered when you fill out your information through PACOS. PACOS is the form that you fill out when you revalidate your Medicare application. So whoever's doing your Medicare revalidation will know the answers to these questions. In your organizational characteristics, we also want to know your category, your ground ambulance operation characteristics. Are you a fire department, police, or public safety, a hospital provider, or government? You're going to be describing this for them because it will help them as they set up other questions when you go through. We also need to know if you have air ambulance, shared services, if you have volunteers, if you're a 911 or non-emergency ambulance transportation service, or both, your hours of operation, and if you're a paramedic intercept. Remember, paramedic intercept is only applicable in New York, but that question is going to come up for you to ask. We have paramedic intercept services, but we don't qualify them in California as paramedic intercept. We don't have that availability here. This is another great point to talk about with Amber. With Amber, these questions are in Amber, they're set up, and they're going to help you. If you set up answer these characteristic questions in Amber, it will help you with the cost and the revenue reporting as you go through. So sign up for Amber, start using Amber. It's like we joked in my office, it's like the TurboTax for cost reporting, because it just walks you through the questions much easier than the CMS cost reporting may do for you. As you set up those questions and you answer them, we're going to then get set up to answer questions 6 through 11, which are our cost reports. We're going to have to talk about our ground ambulance labor cost, our facility costs, our vehicle costs, our supplies costs, and any other costs that we have. So there is a section, if you don't know where to put it, you've got the other. You're going to take all of those costs, you're going to add them up, and you're going to have a total ground ambulance cost. So it does help you do the math. It has these 6 sections, 5 sections broken apart. You put your costs in there, and then you have your total ground ambulance costs. One thing to think about if you are an organization that is both ambulance and another service, that you are going to have ground ambulance costs and you're going to have your organization's total costs, and you're going to need to be able to split those apart and show the percentages for those. So if you're a fire department based ambulance provider, or police department based ambulance provider, somebody who actually shares costs, you need to be able to split those costs up and differentiate those. After you talk about your organization, your characteristics, it's going to want to understand your primary service area and your secondary service area. So this is the area where you are exclusively or primarily responsible for providing service, whether non-emergency or emergency. This is your area where you're responding from. But you also probably have a secondary service area where you have dual response or dual coverage, and you need to go ahead and indicate that secondary service area as well. You don't want to include areas that are under really special circumstances. So for example, if you provided a round trip, we provide round trips from Fresno to San Francisco, wait for the patient, come back. We wouldn't indicate San Francisco is our coverage area. We would only indicate Fresno, which is our primary coverage area. And if you respond to things like FEMA, wildfire responses, MCIs, you wouldn't indicate those in your coverage, secondary coverage area. Again, highlighting amber. Amber is really nice because it has a map for you, and you can just create the map to show your area. You can also use your zip codes. You can use your zip codes to say what your primary and secondary service areas are. But if it's easier for you to do a more visual display for your primary area, amber is really useful for that section. One of the really confusing things that people seem to have is with the service area and response time. CMS does want to understand your response times. So we want to talk a little bit about how the response times are documented. The average trip time is the trip time that the time when your organization begins its response. So when you're dispatching, beginning your response, to when that ambulance is available to take another call. This is an important question to ask because we want to show CMS how long it takes us to be ready for another call. And when you're talking about your long distance transports, there's times where you're not going to be available to take that call. So your ambulance may end the call, again, for that example, when I go to San Francisco, my ambulance ends that call in San Francisco, but the ambulance is not ready to take a call until they drive 3 hours back to Fresno. So you want to make sure your dispatch data right now is collecting that full time of the call to be able to report that average trip time. You want to answer this for both your primary and your secondary service areas when you're answering these calls. One other thing is for your emergency response time. We're going to be asking you with a cost collection for your emergency response time. When we're asking you for that, we want to make sure that you know what the CMS definition is, and also give you an opportunity. CMS is giving you an opportunity to redefine the response time. CMS's response time definition is the time from when the call comes into dispatch to when the ambulance or another EMS response vehicle arrives on the scene. That's their response time. But if you want to, they have two other alternate definitions you can use: from the time the ambulance leaves the station to the time the ambulance or other EMS vehicles at the scene, or from the time our organization receives a call from dispatch to the time the ambulance or other EMS vehicles at the scene. You have those two times. You can also create a third one that you need to define, but you want to see if you can fit your response time definitions into one of these three, and then select in the cost reporting which response time you're going to be using. You also need to tell them about your response times. Is your organization required to respond in a certain amount of time? Who determines this? And if you're penalized, how are you penalized? So you need to be able to answer these questions about your response times. So I walked you through a lot of the demographics. I want to go ahead and turn it over to Michelle. And I want Michelle to go ahead and help us walk through some of the other demographics.
Thank you, Donna. So the next area is ground ambulance service volume. So we'll walk through the different types of responses. Total responses is the total number of responses by your organization, whether a ground ambulance was deployed or a patient was transported. So this could be fly cars going out, supervisors, things like that. So we want to gather those total responses from your ambulance service. The ground ambulance response is a fully equipped and staffed ambulance, whether scheduled or unscheduled, with a transport and with or without transport, and with or without payment. Doesn't matter if you received payment, doesn't matter if you transported or not. So the ground ambulance response is going to take all of those responses by ground ambulance. And if there's more than one vehicle that goes on that call, so a supervisor and an ambulance go on the call, you're going to count that as one response. Ground ambulance transports are the fully equipped and staffed ground ambulance, and it provides the transport. So we're 3 or 4 different buckets here. So the total responses, ground ambulance response, ground ambulance transports, and then paid ground ambulance transports. We're gonna go through those and enter those differently. Seems like I can't advance the slide. Could you? Thank you. So ground ambulance service volume. So response with non-transporting agencies. So do you have calls with non-transporting agencies such as local fire departments? What is the best estimate of percentage of those responses that involved a non-transporting agency? So your ground ambulance responses in your secondary service area, you're going to put in this area as well. So you're doing the main service area, then you're going to do your secondary service area. And then ground ambulance responses that do not result in a transport. So again, the service volume, as Donna spoke to earlier, paramedic intercepts are only in New York State. So what we call those intercepts in our company are actually joint responses. And then the standby events. You're going to make sure that you're entering any of those standby events that you have as well. Next, you're going to go on to service mix. So we want to make sure that we're answering the following questions. The percentage of your organization's ambulance responses and transports by type. So if you're unable to provide an exact percentage, you'll be prompted to select a percentage range. If you don't have any responses in a particular category, please enter 0 in that area. So if you said that if you provide air service in addition to ground ambulance service, please don't put the air in this. It's only for ground ambulance only. So everything combined should total 100%. So this is kind of how the categories are going to be laid out. You're going to indicate the percentage of your organization's total transports that fell in each of these categories. So you can see that they have the HCPCS, or they have the codes with them, so that it makes it really easy for you to figure out which area that those calls go to. So again, those total percentages should be 100% and enter 0 if you don't have any in those categories. I am going to pass it off to Scott, who's going to walk you guys through the labor section.
Well, thank you, Michelle, and thank you, Donna. And thank you all of you for joining us. Just quickly, we did get one question while we were going through the initial sections, and I did answer it, but just in case others have this. The question was regarding if your fiscal year begins in, let's say, June of the year that you've been selected. So let's say you were selected for 23 and your fiscal year begins in June, you would start collecting data, in July. If you would start collecting data on July 1, you would collect that data through what would be June 30th of 2024, and then you would report your data no later than 5 months following the end of your fiscal year. So whatever year you were selected for, if you run on a fiscal year, 1, you have to notify your fiscal intermediary or your MAC. Number 2, you would then start collecting your data on the first day of your fiscal year that begins in the year that you were selected. And then you would collect that data through that 12-month period and then have to report no later than the 5th month after your fiscal year concludes. So just wanted to make sure I shared that with everyone. All right, section 7 of the instrument is the labor section. And this is by far the largest section, not surprisingly, given that really the majority of an ambulance service or a fire department's overhead is generally tied to labor. So this is one, we're only looking for labor that is either partially or entirely related to ground ambulance work. So if you have folks in your agency that don't have anything to do with the ground ambulance, in other words, let's say they're only air, right? Or let's say they are tied, if you're a hospital-based service and they are only hospital, they have nothing to do with the ground ambulance response, then you won't be using their data. Again, if you have someone on a fire department who, let's say, is in inspectional services, never at any point during the year has anything to do with ground ambulance, then you won't be reporting that person's information. We're also not looking for contractor information as well. So if you have people who you have paid as a 1099, then you will not be reporting them in this instrument. So you will, though, frankly, I'm sorry, you won't report them in section 7 of the instrument. As a 1099, you're going to report them in a different section of the instrument that'll be covered later on. Now, labor is broadly divided into 3 buckets of groups of people. The first is either EMT and response staff. So if at any point during the calendar year or the fiscal year, during the reporting period, somebody responded to a ground ambulance call, that doesn't mean, hey, they were certified. It means they responded to a ground ambulance call. We get lots of folks who might have patches on their shoulder that never respond to a ground ambulance call during the reporting period. In that instance, that person will fall into the administrative facility staff. But if they did respond to a ground ambulance call or support a ground ambulance call in a response, then they will be reported in this EMT response staff. And there are categories within that, being paramedic, EMT, advanced, or what they call an intermediate. Now, if they didn't respond to a ground ambulance call at any time, and they're not your medical director, and by medical director, I mean someone who you're paying as a W-2 or who volunteers their time as your medical director, then they are in the admin and facility staff, all right? So just so you're aware, that is how those are, how those folks are divided up. Now, Donna, if you could advance to the next slide, because I'm not seeing the ability to be able to advance that slide either. There we go, great. So this checklist here, or this algorithm, we in EMS, we love algorithms. This algorithm was actually designed by CMS, and I have to give CMS credit. I say this nearly every time we present. Oftentimes the federal government gets a pretty bum rap for a lot of what it does, and sometimes that's earned, but in this instance, it is not one of those times. They have really done an unbelievable job in putting together education material and, honestly, in engaging the industry or the EMS agencies around this country to try and better understand the nature of the costs that are involved in providing ambulance services to people in this country. So this is one of their, and if you haven't done so already, go to the CMS ambulance resources page, all right? And that you can just go into your search engine and type in CMS ambulance resource. It will pop up. Not only there will you find the list of people who have been selected thus far and other things like the cost collection tool, you will also find, and in fact, it looks like, I believe someone may have popped it into the chat, more than likely, Samantha. You will also find there a whole bunch of educational content on top of course, the content that the AAA has made available. You'll find a bunch of educational content. This was one of those, and as you can see at the bottom, it says Medicare Learning Network, Staffing and Labor Costs, Section 7 from February 6th of 2020. This is a really easy, this hasn't changed despite the fact that that they have published an updated instrument. Really, this process remains the same. That you will look at this and run each person in your agency through this. So did the person have ground ambulance responsibilities at your organization during the collection period? If the answer is no, well then guess what? That person does not get reported in this tool or in the cost collection report. If they did, then you will go down through and say, was this person a paid employee at your organization during the collection period? If the answer is no, then they fall into the volunteer category, and you will then further break them down into one of the other buckets of folks that we already talked about. If they're paid, you will then break them down into the bucket of folks that we already talked about. So just so we're clear, right, you need to essentially take everyone, make sure they end up in that initial distribution of folks, either EMT response staff, administrative facility staff, or medical director. And then from there, you need to break them down further. As Donna had mentioned in the beginning of the instrument, there's a whole bunch of questions you answer about your organization and the way that you're laid out. That is done as part of the skip logic process that is both existent and will be existent in the CMS tool, but is also existent in AMBER. So what that means is it's ensuring as you're answering those questions, that you end up, or your data ends up in the right data analysis grouping, right? Because, for example, the cost related to providing ambulance services by a small rural or super rural private agency are very different than the cost related to an urban municipal-based, maybe fire-based EMS agency, right? Those costs are very different. What we want to make sure, and what CMS wants to make sure, is that they are analyzing like data, apples to apples, oranges to oranges, because again, if you don't do that, right, garbage in, garbage out from the data perspective. If you could go ahead and advance to the next slide. So there is this labor checklist, right? Each member only fits into one category, right? So as I had mentioned earlier, in my fire department in my town, when I was on that department for the 16 years I was on, we had virtually every single person in our fire department at one point or another, including the fire chief, responded to ground ambulance calls. We had one person who primarily processed the administrative stuff, was not even a certified individual, and that person really was an administrative person. Now, our fire chief, who spent the majority of her time doing administrative work as well, because she responded to one ground ambulance call during the course of the year, and frankly, she responded to a whole lot more than that, all of her time, all of her wages, compensation, and hours would get calculated into the EMT response staff. So this is a good little sort of exercise. A paid EMT basic who also performs administrative duties, they're going to fall into the EMT response staff, in this instance, in the EMT basic, paid EMT basic. Paid paramedic who also volunteers additional unpaid hours. Now, there's a whole bunch of legal stuff around there, and I say as an employment lawyer, I want to make sure you know you cannot volunteer to do the same duties for which you get paid at the same agency. That is not okay. All right, if you are in that situation, we need to talk offline. So again, walk through with each one of your folks, and this goes back to what Donna had said at the beginning, where you take a snapshot of your staff at the beginning of the data collection period and walk them through, just making sure that you put them in the right data analysis bucket. If you could go on to the next slide. So as we move on, again, there will be, as we're formed, and now some of the ACE faculty staff have had or were privileged or lucky enough to take part in what was really the alpha testing of the initial CMS data collection tool. CMS, as I said, was pretty good at engaging industry professionals, and they asked some of our ACE faculty folks and other members of the AAA to test the alpha version of the CMS cost collection tool. What we, and by the way, Amber and the software that was developed by the AAA in cooperation with SAVIC, or that SAVIC has made available to all folks through the grant, AAA and SAVIC have made available. That software, again, was also developed based upon a lot of what we've learned from our interactions with CMS as we've gone through and worked through this process. Again, there is or will be this checklist. The entire intent of these checklists are to make sure that that they are categorizing or understanding who works at your organization and what are their levels or obligations with your company or with your EMS agency. So you will simply check off, I have a paid staff that don't have any fire, public, or other police responsibility. I have volunteer staff who don't have any fire, public safety responsibility. I have paid staff who do have fire, public, or police responsibility, and then volunteer staff who do. This is really in an effort to make sure that they're lining up your data in the right buckets, because if we put an organization that has paid staff in and analyze their data next to organizations that have volunteer staff, it is going to be very disparate. The data will be so disparate that in fact it won't make sense, and it will create issues and challenges with what the true costs are. All right, again, when there's volunteer labor, there is a cost. It's just your volunteer is bearing the cost of that labor in this instance. So moving on to the next slide. This section, again, is a challenge. You will go through again when it comes to your administrative and facility staff and do this exact same exercise, right? Because we recognize that in my fire department, there was someone who processed payroll and made sure that time cards were done right. That person not only had some responsibilities related to ground ambulance, but they also had responsibilities that were not related to ground ambulance. And so what CMS is really trying to do is to make sure that they're aligning the cost for providing ambulance services in this country in the correct bucket, so that we're not necessarily, because otherwise a lot of the fire-based agencies that have really expensive like equipment that is, my ambulance in my community was twice what the ambulance for any of the private ambulance organizations that I worked for cost. It was just twice the cost. As a result, again, if we don't line those people, put them in the right data analyses bucket, we will end up with very disparate data that doesn't make sense. And by the way, as we think about CMS's previous efforts to collect data back in the GAO studies of 07 and 13, What we found was that they commented a great deal on this issue, was that there was such disparity amongst the data that they questioned the reliability. So what they were really trying to do this time as they entered into this, those efforts were voluntary. This is not, of course, was to make sure that they were removing as many variables as they could that might lead to garbage data, right? Again, data is like trash. If you're going to collect it, you sure as hell better know what people are going to do with it. Recognize if this data goes sideways, or if the data that they get is really not good, the payment structures will be reformed based upon flawed data, right? Last time the payment system was reformed in this country was just around 1999, 2000, when the ambulance fee schedule was put in. I don't know about you, 20 years from now, not that I don't love EMS, but I hope that I have finally been able to retire. So that being said, this may be the last bite at the apple that many of us get at reforming that system. So if you could move on just to the next slide, please. So you are going to have to report, and this is information that while we've made it look, well, truthfully, Samantha made it look a heck of a lot nicer than I had it looking. This is what you are going to find when you log into the tool. You are going to have to report basically by category of individuals. And as you can see down that left-hand side, you will see EMT basic without, EMT basic with, fire, police, public safety responsibility, EMT intermediate with or without, paramedic with or without, nurse doctor with or without, emergency medical EMR, emergency medical responder with or without. In some instances, you may see ambulance driver. That's not to be offensive, that just in some places there are certified ambulance drivers. You are going to then report their total annual compensation. Then you will also report, and I'll talk to you about what's included in annual compensation in just a second, total annual hours worked. All right. So the hours worked annually for paid EMT response staff. They want to know, by the way, we're going to talk about volunteer in a minute. Many of people in volunteer agencies do not track hours. You are going to need, if you are a volunteer agency, you are going to need to establish a process for reporting hours. So the question just came up, when will this the reporting portal open? All indications, right, when that we have is that because the reporting period really runs from any time at the end of the calendar or fiscal year through 5 months following your calendar or fiscal year, we have reason to believe that the portal will open up somewhere after the first of this year. So because the first set of folks were selected to collect their data in 22, to report in January or later, no later than 5 months following the end of their calendar or fiscal year, we have reason to believe that that portal is going to open up on January 1, or because January 1's a holiday, January 2nd. Here's what I'll say to you. There really isn't a huge benefit in getting your reporting in on January 2nd. Not that certainly I understand there are some people who early bird, gets the worm. What I will say is, it is more important that your data is right than that it's first, okay? Because again, this is really going to be the basis for how the payment system is reformed and the future of how we are paid for providing ambulance service in this country. So I think, Lily, it's going to open up roughly a little after January 1 and should be available, frankly, from that point on, because if you are an organization that starts your fiscal year in February, March, or April, the end of your fiscal year will be in February, March, or April, and then you will have 5 months following that to report your data. Now, as I said, CMS kindly did invite a bunch of faculty or a bunch of AAA members to participate in the alpha testing of what they have designed for this, because this tool doesn't exist. We know that a lot of people have told us that, hey, Medicaid has got a great cost collection tool, or hospitals have a great cost collection tool. This is not that. Let's be clear. So this is new. And so while there are some relationships between Medicaid cost reporting, I will tell you that this is something very different. Just because you have that mastered doesn't mean you're going to have this squared away. This is something very different. So what you are going to do, by the way, is do your total compensation, which I'll talk about what that includes, and the total hours for paid EMT response staff. And then they are going to ask for the total hours worked annually related to ground ambulance operations, right? So if you have folks who are dual role, they're hospital-based or flight-based paramedics, you're going to have, there are times when that helicopter is not flying and they're in a ground ambulance. If they are a flight program in a ground ambulance, you are going to be reporting those ground ambulance related hours and wages or compensation. So what they're looking to get at here is, hey, if I've got a firefighter who also has ground ambulance responsibilities, I'm going to report all of their hours, and then I'm going to have to account for what percentage or what part of those hours, and you're not really percentage, you're going to report hours, were related to ground ambulance. There are a number of ways in which you can do this. Our recommendation is that you create a document internally at your organization to let people know how it is, or how basically you did it at your organization. All right, because different organizations are going to have different ways of tackling this. And what you do, if you're like me, you don't even remember why you did certain things. While this is right now slated to be a 2-year event, right? So half of the industry this year, half of the industry next year. What I will say to you is, I believe once data starts getting collected, they are never going to stop this process. That being said, that is a good thing. Throughout all of the pandemic, we really struggled every time we went to Congress asking for more money because our costs dramatically increased. They would ask us for data. Oftentimes, we had no systematically, reliably collected data. Most of the time, right? Think about the old Reagan saying, trust but verify. We didn't have any information that we could point to them, any reliable, systematically collected information that we could then share with them to show that, in fact, our cost had increased dramatically. The other thing that I will say, the advantage to also using things like Amber, are that we will know when things like EpiPens go out of control and the prices triple or quadruple. We will now have data. We will be able to spot that data, and we will be able to now go back to other lawmakers in an effort to try and influence reimbursement rates and or private insurers. So you are going to all hours related to ground ambulance service. Then they're going to ask for total hours annually related to police, fire, or other public responsibilities, and then hours worked annually related to other responsibilities. So what they're looking to do is break that down into, to really get to understand what part of this, what part of the hours and what part of the compensation are tied to ground ambulance. If you could advance the slide, that'd be great. So what's included in compensation? Pretty straightforward. Salary, wages, overtime, training time, standby time, can include payroll tax, and will include things such as your cost. This is your total comp, right? If you use a total comp statement or you don't, you should get the one down off of the AAA website. Total comp includes things like, what is the organizational cost on behalf of your employees for healthcare? What's the organizational cost for retirement, for any stipends that you might pay? Paid time off. I want to make one quick note about paid time off. Paid time off do not include if someone had 80 hours of vacation time that they took. That's included in wages, not included in hours. Okay, so I want to be clear. Hours worked means only the hours actually worked, not PTO, sick time, or any of that kind of time. All right, life insurance costs, those benefits costs, when we look at total compensation, it usually includes wages, overtime, that kind of stuff, plus the benefits costs associated with that. Okay, and you're going to need to get those. Now, if you're an organization that is a municipal-based organization and somebody else is responsible for one of those costs, like, for example, your firefighters are in the municipal retirement system and on the municipal healthcare plan, you're going to need to go to your community, your town hall, your city hall, and get that information so that you can report it. If you could advance the slide. So same thing for administrative folks, okay? It's broken down exactly the same way. These are your dispatchers, your HR people, your IT people, your fleet maintenance people, anybody you have that's doing work around the stations, anybody who's not an EMT response staff and not your medical director will fall into this category. Again, they're going to want to know what's their total compensation. For in the first column, you see for medical director, total compensation for administrative facilities or medical director, right? They're looking to break all of that down. All right. The total compensation for administrative facilities and medical director, total compensation for administrative hours for administrative facility. What of those are related to ground ambulance service? What are those related to the other responsibilities? And then hours worked related to all other responsibilities. Once you go across that column, right, again, as you go from total hours worked annually The other 3 columns, that total hours work related, total hours basically unrelated to ground ambulance, and then total hours unrelated to either ground ambulance or those other public safety responsibilities, you should have the 3 columns on the right should equal the column in that second column. If you could advance to the next slide. So public safety organizations, again, this is exactly the same exercise. They're just looking to go through and understand. There are people who work for public safety organizations that don't have responsibilities outside of their ambulance. Now, that could be a third service, right? So a standalone municipal third service, or in some departments, the folks who are hired to work on the fire department ambulance only work the fire department ambulance. They may not even be certified firefighters. Alternatively, talked with an agency this a couple of weeks ago in Texas, where every person on their combination police, fire, and EMS department is both a certified police officer, a certified firefighter, and a registered paramedic or EMT, which is kind of a cool system. However, right, I would imagine there's a lot of overlap in roles and trying to figure out how they do that. But I think it's one of the cooler systems I've heard of. So you're going to go through again and break this down based upon EMT basic without public safety or fire, police, public safety role. All right, this is the same thing. If you answered that you are a public safety agency, you are going to see these questions. If you answered that you are a standalone private, for-profit, or not-for-profit organization, non-municipal, non-public safety, you won't see these questions at all. So if you get to this section and you are seeing these questions, you can know for a fact that you have answered something incorrectly somewhere earlier on in the tool, and you can go back. One of the things that we've heard so far about the tool is that you will be able to save. Initially, when they did the testing, you weren't able to necessarily save as you move from section to section. This one, you are going to, as we've been assured that you're going to be able to do so. Now, the numbers that Donna quoted earlier about how long it was going to take was actually the estimates that CMS gave. We think actually it's going to take you a little bit longer than that, because again, to suggest that it might take you about 20 hours to get all this information, I think that's true if you've done your homework and you've set your system up to make sure that you can easily get all that information. We think best case scenario, it's about 20 hours if you've done this groundwork, set up your systems to make sure, and that you've established, just like for those people who are CAS, you should have a team project or a project lead for cost collection. If you could move on to the next slide, please. So volunteer labor, again, one of the challenges we have for a lot of organizations, and this has been challenges in the past for data collection. When it's come to doing collection for volunteer agencies, a lot of times, right, folks have not included those costs, because there are costs. As I said, it's just the volunteer bears a bunch of those costs. Now, in a lot of fire departments or municipal agencies that run volunteer systems, they don't utilize any sort of mechanism for tracking time. Volunteer agencies are going to have to track time, because that is an element of cost, and it is a real cost. It just, as I said, happens to be that your volunteer is bearing that cost. If CMS didn't get the information, guess what? It would look like certain ambulance services around the country. It's really cheap to provide. What we know about volunteer agencies are they are going away little by little. So there is a cost, and CMS wants to be prepared to make sure that when those agencies, if and when those agencies do start to close up, right, again, there should be some sort of allowance made for the fact that there is a cost there. Just right now, somebody else is bearing that, because what we're seeing are volunteer agencies that are closing, and paid agencies are having to come in and take over. So they're looking for folks, right? What category was that volunteer in? How many people volunteered for your system? How many hours did that volunteer work in your typical week? Actually, the typical week now, they're not really looking for the typical week. What they're now looking for is how many hours did that person work during the data collection period. So you are going to need a mechanism. That doesn't have to mean that they punch clocks. You could have from the time the tone goes off, like in my fire department, when the tone went off, that was when the clock started ticking, because people were presumably responding. And then when they gave us the all clear, after everyone was back at the station and they released everyone, then that could stop the clock. All right. You need a mechanism for doing that. It doesn't necessarily need to be an electronic one. You just need to make sure that you are collecting that information. You do not want to estimate. What I have learned over the years are that people are absolutely horrific, either overestimating or underestimating. Very rarely do they get it right on the nose. So this is an area where, again, we want to be as accurate as we can be. If you could advance the next slide, please. So what are we talking about? Right there, looking for all hours worked related to ground ambulance service, all hours worked if in fact it's related to fire, police, and other public safety functions, right? Again, we don't want those hours related that are unrelated to ground ambulance. Air will ultimately, I think, have their own cost collection process that's going to occur at some point. For whatever reason, CMS was choosing ground ambulance services. So if you're an air agency that doesn't have any ground ambulance obligations, well, then you don't really have to worry about this. If you're an air agency, like most of the ones I know, when it's too dangerous to fly or the conditions are not such that they fly, they go on the ground, you are going to have to report your ground side of that and not your air side. All right. Those, again, we just want to make sure we're not including those things that are not ground ambulance, and they're not looking for volunteers who are just hanging around waiting for the tone to go off. If they're at the station and let's say they meet that they're forbidden from leaving the station, so they're really engaged to wait rather than waiting to engage to wait, right? In other words, they work a volunteer shift at the station. That would be hours worked. If they are able to do what they want with their time, and you can look at the Fair Labor Standards Act regarding what equals volunteer. And if you're not sure, reach out to hello@ambulance.org and one of us will get back to you to make sure that we help you work through that. We answer questions, by the way, several times a day, every day of the week. We have been for months, actually years at this point. We're not also looking for time spent fundraising. So we know that a lot of volunteer agencies fundraise for their agency or they hold the boot for like the Jerry Lewis Telethon. We're not looking for that. Those are not considered working hours because in that instance, again, that's fundraising hours, not really tied to the provision of ground ambulance service. Or CMS has made the decision that they're not looking for that fundraising stuff. So I'm looking to see no other questions so far. All right, next, what you are going to do again is go through this not only for all of those volunteers. In some agencies that have volunteer, often they also have a volunteer medical director, right? So again, if your medical director is a volunteer, in other words, they just out of the goodness of their heart, not your affiliate. If you have a contract with a hospital to provide affiliate medical direction, in other words, that's somebody you pay under a contract with the hospital, you're going to report that in a different section in the tool. All right, if you have someone that you issue a W-2 to, or they are a volunteer for your organization, then you would report them in section 7. All right. If you had any stipends, honoraria, or other benefits that you provide to volunteers, and I've done webinars before in the past about sort of the legalities of when someone is a volunteer versus when they're paid. Functionally, the law says that basically if they make more than a nominal amount, they're paid. In other words, their volunteer and the stipend or the honoraria has to be below what works out to be roughly 20% of what you would have paid a paid individual for that same work. That being said, they do want you to collect that information and you would report that in this section. All right, next slide. So Amber does a great job. Again, I think had we known there would have been this pandemic, isn't that like the line of all lines, we would have done things differently. At the time that we started to develop Amber, the pandemic had not occurred and we believed the window for collecting data was less than 12 months. The AAA hired a third party to develop Amber. It is a software development company that has extensive experience in not only developing software for other healthcare institutions, but also for government boards or for government agencies as well. In fact, Aaron, who is one of the primary folks, is also or was a member of the Government Accounting Systems Board, right? So a lot of experience and background in this. There is a firewall in between what data you enter and what the AAA can see. All right, understand AAA will not be able to see anybody's individually identifiable data. So if you're worried about, hey, we're a fire department or we're a private agency and we really don't want the AAA knowing what our individual costs are, have no fear. I actually reviewed the contract myself. There is a significant firewall that will prevent the AAA from ever accessing anybody's identifiable information. So what's important about this is we've said data is like trash. We're going to collect it. You sure better know what people are going to do with it. What we do know is, right, if we start to be able to look at the aggregated de-identified data and see, right, that, oh my gosh, this data looks a little bit different than we anticipated. Maybe the costs weren't as high as we thought. Maybe the reimbursement was closer than we thought. Or what happens if the data that CMS gets look very, very different than the data that we see in our system, right? Both offensive and defensive is what we will be using the data for. So had we known that there was going to be the COVID delay, we probably would have developed Amber to first be a transactional accounting based or, sort of bookkeeping based software for ambulance services. That part is being developed now that we know there's been this delay. And then we would have developed the reporting piece because we thought the reporting piece was less than 12 months away. We developed it from a reporting piece first. Hindsight, always 2020. If you could advance the slide, that would be great. So I am actually passing this back off to Michelle, and she's going to handle section 8 of the facilities piece. Thanks, Michelle.
Before we move on, we do have one question. We are a special district that has a public agency filing. Would we be considered public safety?
So that's a really good question. So if you're like an ambulance district, if you were a standalone unit, and what would be, and some of them are called a public-private partnership, which sort of the way that the tool breaks these down are basically private for-profit, private not-for-profit, a municipal or governmental agency, a public-private partnership. And then I think there's, for those agencies, I know there were a bunch that are like governmental subdivisions or a specific subdivision for ambulance districts, very common in the middle part of the country. In my opinion, you would be answering or responding as a municipal agency or under that public-private partnership. So I don't know if that helps, and it may be very well that I don't understand exactly the nature of the question, but if you are a pseudo-governmental agency, I would probably be responding as a governmental agency and then addressing it from there. If you are supported by tax dollars, not because you're paid a stipend or a, let's say some sort of, you're a private entity that's contracted with an agency and they're giving you money to provide ambulance response, different than if I am a tax supported entity, essentially a political subdivision of a governmental agency, I would report as a governmental agency. So I don't know if that helps. If not, again, drop the question into hello@ambulance.org and we'll take it offline and we can do some additional research or get more information from you.
Thanks, Scott.
All right.
So in section 8, we're going to talk about facilities. So each one of your facilities, you're going to enter in separately. So you'll put a name to the facility, whether you rent or lease and make a payment for that facility, whether your organization or another entity owned the facility or made payments towards that facility, your organization, if they own it outright, or if it was donated, and then the square footage of that facility. So the total square footage of the facility, and then the percentage of the facility that's used just for ground ambulance. So for example, if you have a fire department sharing or a department sharing a garage space with fire apparatus and ambulances, you're going to take the percentage that's just the ambulance area only. Next slide, please. Perfect, thank you. So then you're going to talk about the lease, mortgage, and other costs for those facilities. So again, you're going to have that facility name, and you're going to put the annual lease cost or the rental cost for that facility. If you don't have a lease or rent, you're going to put 0 there. The annual depreciation expense, the acquisition cost during the year that you're reporting, the mortgage interest, bond interest, or other costs of ownership, and if it's owned and no costs are reported, the annual cost of the ownership. So the excluding maintenance and utilities, those are going to go in a separate area. Next slide, please. So here you're going to report the insurance, maintenance, utilities, and taxes. So you're going to pull that out of what you reported earlier, and you're going to put in those the facility's insurance, the maintenance and improvement, the utilities, and the taxes. And you're going to enter the percentage that of those facilities that's attributed to ground ambulance only. Next slide, please. In section 9, it's going to be very similar to section 8. You're just going to go through those vehicle costs. So how many ground ambulance vehicles does your organization own, and how many do you lease? The next slides will go through a little bit of that. So for the owned vehicles, you're going to name those ambulances. So if you have a tag name on the ambulance, you can put that here, or if you know how to name that specific so that you can go back and enter the proper information for those, you're going to put that here. And then was it used to transport patients during that reporting year? Was it donated? The depreciation, the annual loan or interest costs of ownership that wasn't previously reported, was it remounted, and the cost for the remount. So you're just going to put all of those expenses for those owned vehicles. And then you're going to do similarly for the leased vehicles. So you're going to have the ambulance name and was it used to transport patients, and then enter the annual depreciation expense for those leased vehicles. So other vehicle costs. So do you own or lease any non-ambulance vehicles? So these are QRVs, SUVs, fly cars, supervisor vehicles, sprint cars. So how many you leased and how many you owned? And what was the total miles traveled by the non-ambulance land vehicles, and then the non-ambulance water vehicles? You're going to put all of that mileage in as well. And then you're going to also put in the depreciation expense for each one of those. So if you own the vehicle, you'll provide either the annual depreciation cost or the acquisition cost during the reporting year. So, and then you're going to enter the type of vehicle. There's going to be a little drop down in there, and you're going to be able to enter whether it was a QRV, a fly car, sprint vehicles, other vehicles. And then you're going to put in your depreciation and only acquisition costs if you purchase the vehicle outright during the reporting year. You do not include registration or license, insurance, maintenance, fuel expenses. Those are going to go in a separate area. Next slide, please. And then you're going to go on to do the same thing with your leased vehicles. So similarly, the vehicle name, was it actually able to respond to ambulance calls during that year? The type of vehicle, so again, the QRV, fly car, sprint vehicles, and then the depreciation expense, and then the miles that were traveled that were related to ground ambulance only. So the next section is the equipment, consumable, and supplies. So we'll talk a little bit about capital. So you're going to report all the capital medical equipment that's used entirely for ground ambulance during the reporting year. So what we're talking about is defibrillators, monitors, power lift cots. You're going to add in the annual depreciation expense, the maintenance, and then the service costs as well. So they're going to ask about all of those different areas. Next slide, please. The non-medical equipment and supplies, we're talking about capital here as well. So these are things like computers, dispatch equipment, furniture, all of those types of things. You're going to add the depreciation expense, the actual amount. You're going to also add the maintenance and certification and all of those service costs in, the total amount. And then you're going to add what percentage is attributable to ground ambulance only. They're also going to ask you a little bit about uniforms to make sure that you're able to parse out the information that's attributable to ground ambulance only. So the other costs. So we're talking about billing services, if you contract for those billing services, dispatch centers, if you're contracting for that. Some places actually contract for EMT and labor services. So you're going to make sure that you're entering that here. So any services that you have that have outside contracts, you're going to enter in section 11. So if you are contracted, you're going to check the box. You're going to enter the dollar amount that the service costs you, and then the percentage of attributable to ground ambulance. So you're going to indicate if your organization had any of these other expenses as well. So don't include any costs that were already attributable to your ground ambulance that you've already answered the questions to earlier. So things like biohazard waste, board of directors fees and expenses, subsidies paid, miscellaneous administrative fees, IT software, Training and education costs, the materials and travel, all of that. So you're going to enter that all in here in this section, in section 11. Next slide, please. And again, these are just another list. This is a longer list of the fees, fines, and taxes. So did you pay taxes? Have you paid for licenses? Any interest paid? Lots. The list goes on and on. All right, so you're going to enter your total expenses for the reporting year, and then your total cost for the reporting year. So it all just combines together, and you're going to have that lump sum number for total costs and other costs. And I believe I'm passing it back to Donna.
Yes, Michelle, you're all done. So going on to the next section, and you know, maybe I'm a little biased being in charge of revenue over here at American Ambulance, but I think that the cost reporting tool has left the best section for last. Talking about the revenue, where's the money coming from that you're going to be reporting? So revenue is section 13. You're only going to include the revenue for the NPI that was selected. So if you have dual NPIs or multiple NPIs, make sure you're only using reporting the revenue for the NPI that was selected. That other NPI will be selected sooner or later to be reported. You're going to report the net revenue, not uncollected amounts. So when we're talking about reporting our revenue for Medicare and Medi-Cal, we're talking about the amount you collected from them, not necessarily what you billed to them. And make sure here you're not including your air ambulance. And don't report revenue from different sources twice. There's a couple places where you might be able to report revenue in one category or another. Make sure when you're dealing with revenue, just like with cost, you're not double reporting on revenue. Pick a section and report it. One of the key components here is that CMS does want to know about your non-transports and how you collect money for your non-transports. If you can, it's ideal if you can split out your non-transport revenue and put it into a separate reporting category. But if your reporting agents, your billing software is unable to do that, then you can report it in the first section. Revenue is broken up into two sections. Section 1 is what I like to look at as your ambulance billing software revenue. It's revenue you could probably pull from your ambulance revenue. And section 2 are your other costs not related to ambulance ground transportation. So we'll look at those two sections separately and talk about how they operate. The first section talks about revenue and it groups it up by different categories. They have these seven or eight categories you have to report from. They want your fee-for-service Medicare and your Medicare Advantage separated out. They want your fee-for-service Medicaid or Medi-Cal in California, and then they want your Medi-Cal managed care reported. And they also want you to separate out TRICARE, Veterans Health, commercial insurance, workers' comp, and then patients in self-pay. So you're going to need to categorize your reports from your ambulance billing service into these separate categories. One thing I think is useful for us here is that we have the QAF report. And I'll talk about how our QAF, our GEMT quality assurance fee report is similar to this and how you can utilize that to branch off into a report. But before we do that, I want to talk about primary and secondary reporting. And what I mean by that is a lot of our patients have an insurance, and then they either pay the copay or they might have a secondary insurance. And if you're able to split out that amount and report it, then that is the question that we're dealing with here, where it says, yes, if indicate if cost sharing, i.e. the amount for transport that is billed to a patient with this insurance was included. So for example, when you're talking about your traditional fee-for-service Medicare, you're going to indicate yes if you weren't able to split out the cost share, meaning the copay or the revenue you got from the secondary insurance to Medicare. So an example here is, well, let me go back one slide. An example here is Kaiser paid you $600, the patient paid $200, your report shows $800 referred to commercial. In that case, you would put a yes if you would put a yes here if this includes that cost sharing. If you're able to split out with your reports, if you're able to show that Kaiser paid $600, patient paid $200, and your report groups that payment into the commercial and of the self-pay, you would put no there. For a lot of people, it may be difficult to split out the report, so it's most likely you will be putting yes and just grouping those copays and those deductibles for that primary insurance into that first category. that's kind of some clarification on that question they're asking right there for primary and secondary reporting. And you want to check with your software vendor to see if they're able to split out that money or if they're going to keep it under one bucket under the primary category. The other thing I want to talk about when it comes to this report is your QAF report. We've been reporting to the state of California for 4 years now, a revenue report. It's due August 15th or 14th, around there, every single year. And it's a report for our revenue. And we can use this report. We can talk to our software vendors and we can use this report and develop it. So for example, this report, there's a QAF category for traditional Medi-Cal and Medi-Cal managed care. We have those categories in our QAF report now. So we have those payer categories already split out, and we can use that report. However, for Medicare and Medi-Cal, those two categories they have on our QAF, we have Medicare and managed Medicare put together as one insurance. So what that means is for the QAF report, we're going to have to ask our software vendor to split those two categories out. So you want to identify your Medicare and your Medicare Advantage insurances and split them out for this report. Work with your software vendor, but they should be able to take your QAF report and they should be able to develop that. And then the other problem is our QAF puts everything into the other bucket. We have a lot of insurances in the other bucket: TRICARE, the VA, commercial insurance, workers' comp, and patient self-pay. Those all need to be split out from that other bucket. So again, I think that the QAF report is a good report to start with, but work with your software vendor and help them identify how you can split up the other category into these 5 categories that we need. A couple other warnings when you're using that QAF report. That QAF report is for emergency transports only, and you're supposed to include for this cost reporting all of your transports. So when you're adjusting that QAF report, if you plan to go that route, you want to make sure that you're adding on all of your transports. And just realize the QAF report is much less developed than other cost reporting. A couple other things to be aware of is that in addition to those revenue resources in Part A, there are some other categories that are reported in Part B that might be in your ambulance billing revenue billing software. So you want to look to those categories. Specifically, non-ambulance services reported in the second part, standby events, bad debt collected, also non-transports can be reported. So the second group of revenue is what they would consider non-ground ambulance transport services, and they're grouped up into, they have two slides of these, but there's a long list of revenue to report. Contracts from facilities, for example, hospitals, nursing homes, prisons, and businesses. You may be putting that into your ambulance billing software. It's not in the other category that we just mentioned, so you'll have to pull out money you receive, revenue you receive from facilities. You need to pull that out again from that report and put it here in this category and group it together. If you put your standbys into your ambulance revenue software, you'll want to go ahead and pull the standbys out. And where it says EMS services, not transports and not contracts, that's where you're going to put your non-transports if you're able to pull that revenue out from your reporting. So if you can pull your non-transports out, you'll put it in this 4th category here. So these yellow highlighted items on this list are where I think it would probably, this revenue would probably be in your ambulance billing software, and you'll want to pull that out. If you're going to modify the QAF report, you should have a category for the contracts, category for standbys, category for non-transports to put it in there. This EMS services, where it says not transport / not contracts, what it means is you're not going to report your contracts here because that's covered in the very first item there under contracts from facilities. Otherwise, this Part B of revenue, except for these categories, these are where you're going to be reporting items that may not be in your ambulance billing revenue, but money that's coming in. A key highlight for fire departments or nonprofit organizations, we do have a lot of agencies in California who have membership fees, and right under EMS services, there's where you're going to report your revenue for membership fees. You might be receiving charitable donations. There's that right there. And as you go through, these items become less and less common, but they've tried to list out a host of revenue items for you to report on. Again, there's 2 pages of this. So second page, we've got some bond or debt financing, special purpose grants. You're just going to go through these. And my suggestion is you get with your accountant, you get with your financial person, you say, okay, where's all our revenue? Here's our ambulance revenue. Where do we plug it in? Here's our non-ambulance revenue. Which category will it fit in? And that's how you're going to fill in your revenue. But make sure you only report your revenue once. So if you aren't able to pull out your non-transports, don't put your non-transports on there twice. Just put it in there once, and make sure you're going through with your financial person to say, where is this revenue going to report? Where is the most likely place to report this? And that breaks apart the revenue into categories to help you understand that. So with that, what are we going to do? Let's make sure if we were selected for year 1 or year 2, head to the CMS website, download the zip files for year 1 and year 2, search for your MPI and determine if you were selected in year 1 or year 2. I hope that you already know if you were selected for year 1 or year 2, because the next thing you want to do is you want to contact your MAC. Scott mentioned from the question we had, what do we do if our fiscal year is not the calendar year, January through December? You're going to want to contact your MAC and let them know what your fiscal year is so you can move your reporting event. The way that it works is your fiscal year starts, your fiscal year ends, and 5 months later, your cost reporting is due. So your fiscal year really determines when you're going to be reporting your cost reporting. Then you want to make sure you sign up for Amber if you're going to use Amber, and review your PAYCOs. That's where you do your revalidation, review your PAYCOs, because what's in your PAYCOs should match up with your cost reporting. All the ambulances in your PAYCOs should be the ambulances that you have in your cost reporting. Really good idea, before you start your cost reporting, you get a snapshot of your personnel at the start of the year. If you didn't do that and your report is due, make sure you go backward and track where your personnel started at the first of the year, because where they started is where they're going to be on the report. And make sure you are able to go ahead and go back and track your volunteer time or hours if you have volunteers. Make sure you have your dispatch systems in place to track both your response times and track your total ambulance time, because you're going to need both of those times available. And make sure you have a snapshot of your vehicle mileage. Luckily in California, Medi-Cal requires we track the odometer, so you should have your odometer log anyway for billing Medi-Cal. So hopefully you have a snapshot of your vehicle mileage. And make sure you're working with your billing services, that your payer categories are set up in this unique way in order to track that money. The CMS report wants to track federal money, so they want the VA, the workers' comp. They want some of those state money separated out. So that is what we want you to do immediately. We hope you've enjoyed this webinar, and we'd like to go ahead and make sure we've got any more questions. Have Michelle and Scott join me, and we can answer additional questions that have come up.
Yeah, and one thing I wanted to let you know, I did go ahead and took a look back at the tool and the question regarding we're a special district. And so some of this is going to come down to terminology. The 4 categories of organizations that they have listed in the tool are for-profit, not-for-profit, but excluding governmental entities. Government, meaning federal, state, county, city, township, or other municipal. And then lastly, public-private partnership. So whichever one that you believe and it sounds like a special district is likely a governmental entity, then I would list yourself there, which is what I think I sort of said, but I wanted to make sure I was a little more definitive. So any other questions that folks may have? I don't see any. I don't know if Sam, you see any either. I know we're a little ahead of schedule, which is good. Usually it's me rambling way on after the time has ended. So
I don't see any pending questions, but we can give everybody a few moments in case they are actively typing any questions. And again, just a reminder that I did drop a number of resources in the chat. I will include those resources in the after the webinar email as well, along with the recording link, so that everybody has access to those. If you have any additional questions, feel free to reach out to hello@ambulance.org. And I do just want to put out there as well that we do have a live in-person workshop coming up in San Francisco, California, January 2023. Additional details to come, so please save that date on your calendar. We look forward to seeing you there. And it does look like there are a few questions coming in. So the first one I see is, we are in one business park with several buildings, so therefore 4 separate addresses, one location, or is this multiple facilities?
well, I'm happy to grab that one. If you were in like an office park, which often will have multiple facilities, and you actually have operations in each one of those buildings. So let's say you have a garage space in one part of the office park, you have maybe Class A office space in another part of the office park, maybe there's a classroom in another part of the office park. In that instance, I would list those as 3 physical separate buildings if they have 3 physical separate addresses. So for example, if it's 100 Main Street, Suite A, 100 Main Street, Suite B, 100 Main Street, then I would list those as separate locations. And you can list those however you would list them. You might put, you don't have to list the address per se, you can just call it education facility, you can call it headquarters, you can call it garage facility or station 1, station 2, station 3, whatever your normal nomenclature is for that, that is how you do it. Now, if it's one physical location, really not one physical, if these are separately insured buildings, then I would list them separately. If it's really one building, then you would list that individually. So I hope that answers the question, Corey. A good one, a very, very good one, because that is pretty common. Would American Recovery Plan funds be considered other revenue? For example, the ERTC or the Employee Retention Tax Credit. So great question. Here's again, one of those things where if it would depend upon how you received those funds, right? If in fact, like for example, when everybody just got a whole bunch of money dumped in from Medicare back, now you're not going to be reporting on that. You're going to be reporting on 22, so that very unlikely happened. You would report that under the Medicare category. If these were special purpose, whatever category you received those funds in, if they were special purpose grants, let's say they were funds specifically to be used for a very specific purpose, there's a spot in the tool that says special purpose grant money. If, for example, they were just, if in fact, by the way, it doesn't fit in one of those other categories, it's perfectly fine to list it as other revenue. You just are going to have to identify what that quote other revenue is, and that would be specific. The important thing is don't count it twice, because that would be inappropriate. I don't know if Donna and Michelle, you have any other suggestions?
No, I think we can go back and look at the revenue categories real quick.
Yeah.
Special purpose grants, those are generally state.
Yeah, and if there were like, dollars earmarked for EMS services, that again would be, there's a slot in there specifically there. So I think that answers it. I've reviewed the year 1 and 2 spreadsheets and have not found our company name, I think is what that says. Company has not found our company name or either. What does that mean? Is there something we need to do? Great question. So one of the things I'll say about the spreadsheets, first of all, I don't know why CMS hasn't now combined the year 1 and 2, because we really only have 2 collection periods. Here's what I'll say. If you have an NPI that was on, I would look number 1 by NPI, looking by state. We found many, including my fire department, who was like, wow, we weren't selected because they went to the state, sorted by state, and didn't see their name on there. What it turned out was their billing agent was in another state. And as a result of being in another state, somehow they had gotten categorized in another state. Search by your NPI. If you're not sure where your NPI is, you can go to the NPI, just go into Google or any search engine and type in NPI search. You will then be able to plug your organizational name in, and it should be able to furnish your NPI. Then just do a search in the Excel spreadsheets by NPI. If you're not in either 1 or 2, list 1 or 2, I have some news for you. You are in the next group of people. All right. So when Donna said they'll publish that list, I got news for you. If you weren't yet selected, you've been selected for next year, right? So, and by the way, if you never get selected, let's say somehow you're an organization that didn't get picked in the year 1 or 2, and then when they finally published the next list, you aren't there either. That's a little unnerving to me, because I don't understand why you wouldn't have been picked. I guess I would go out and buy a lottery ticket, because more than likely you've just hit the jackpot. However, what I would do is really go back and comb through those lists, not only by state, by name, by, if you go into Excel and put, hit the find button and you just put in part of your name, it should be able to bring it up. You really do want to make sure it's by NPI. That is the best way to check. And again, if you weren't picked in 1 or 2, you are on deck for the second half of this process.
Definitely. We have 2 groups of people. We have people who were selected and are required to start reporting, and we have people who are going to be selected and will be collecting their data to report it in 2024. So if you didn't get selected, I wasn't selected, a little sigh of relief. And then I found out, oh yeah, Donna, winter is coming. We're going to be selected. We're going to be putting this together. So,
and then one other comment I'd make is, if you, as you mentioned, I think, is if you're a multiple NPI organization, we know people who have 2 or 3 NPIs and all 3 were picked in year 1. And then we know some who none of them were picked in year 1. So just remember, it is by NPI. And this could be a really good strategic reason to start to consider, geez, do we split out our wheelchair ban into a separate NPI? Because just moving forward, if we're doing it now, by the way, guarantee we're going to continue collecting data moving forward. Just a gut I guess. But what I would say is this may be a time when you consider, geez, do we essentially merge these two organizations into one NPI so that we're not having to potentially report twice? That is something that you may want to consider. So that's just some strategic considerations as it relates to this. So I'm sorry, Donna, I think I cut you off as you.
No, no problem at all. It's a great point to make. In terms of our strategy, I just want to mention this is the first of a few events we're going to work with the AAA, the California Ad Association, and the AAA are going to be working together for cost reporting. We have our January 12th, save the date. The AAA, it does have this great email address, hello@ambulance.org. Type that in and ask all of your cost reporting questions, and one of the great faculty members will answer that question. They'll collaborate if they need to make sure we understand it. But we at the CAA want to make sure that all of our California members and non-members are participating. We think this is a really important event to help us. We here in California are trying hard to increase our Medi-Cal reimbursement. It's very underfunded. One way we can do that is if we have the Medicare cost reporting tool, we can show to the state of California, this is our costs and this is how we're underfunded. So if you're not on the bandwagon yet, if you're not a fan of cost reporting yet, now's the time to go ahead and join the bandwagon, because this is what's going to help us get reimbursed. Scott, we have a question coming up from RJ Morrison.
Yeah. Was the split an organization for two MPIs or was it combined for single? So I think, RJ, what your question is are you suggesting that possibly you split one MPI into two? Maybe you peel your wheelchair van off into a separate one, or that, hey, maybe we have two separate organizations. Maybe we bought one or we started two different ambulances and now we're considering, geez, maybe it makes sense to combine these organizations into one. There are a whole bunch of strategic reasons why you might have a separate MPI. That being said, yes is the answer to that, which you're like, Scott, that's not the answer. Like, you didn't really answer it. What I'm saying is, it may make sense for you to peel out part of your business that isn't Medicare reimbursed, for example, wheelchair van. And so that you're not having to, again, while it is costs that you would, or possibly you might have bleed over costs for people who are EMTs who sometimes respond to ground ambulance calls, but sometimes go to wheelchair van. Again, you may want to split those out so that you are actually not having to do a lot of fancy accounting. Alternatively, you may merge organizations so that, and maybe retire an NPI or merge those NPIs, working through the administrative perspective with the CMS to get rid of one of them, so that now you're just able to report as one entity rather than having to really dig those NPIs down into separate breakouts of cost. I think that's really important. So RJ, hopefully that answers that question. One thing that Donna said that I would like to comment on is, I know, by the way, if you're on this webinar, while you may have tons of questions, you're actually someone who we're less concerned about than the 8 to 10 people that each of you probably know who run or organize or work at ambulance services that would never ever sign up for the CAA, or would never ever sign up for the AAA, or would never even engage at all at any level on cost collection. What I will tell you is, it is time for you to reach out to those people and tell them, not only will they potentially suffer that 10% penalty if they don't report, but also, again, given that this is likely the last time they're going to reform this during my working career, just remember that they are going to base and reform the payment system. So not only will you suffer that 10%, you very possibly could suffer a significant redistribution of the funds, if not a reduction in the funds that are currently reimbursed to ambulance services. So for all those people who just don't either engage because they don't have time or they don't have any interest, it is time for you to tell them how important this is, and if not, just at least get them engaged on some level.
And I'm just going to jump in. I know we talked a little bit about that SAVIC grant earlier. So if you're not a part of the AAA and you want to use that Amber tool, it's a really handy, wonderful tool to use. Please sign up. You know, that first year of the AAA membership plus the Amber subscription is well worth it to sign up for. So if you haven't done that already, please jump on and do that.
Thanks, Michelle. It sounds like that's the end of our questions. Hopefully we've convinced you to join in on the cost reporting with us. Find your friends, join them. Please join us. We've got that event coming, a live event that is January 12th. We're going to have the details of the exact location and times as we get everything sorted out. Scott and Michelle, wonderful to present with the both of you. You guys are really knowledgeable about this, and I appreciate your time today. Hopefully that's all of our questions. But again, hello@ambulance.org if you have additional questions we didn't answer today.
Really, thank you, Donna, for hosting, inviting the AAA, and for joining the ACE faculty. We're excited to have you aboard. So thank you, everyone. Thanks so much.
Thanks.
Samantha, anything else from you today?
Nothing else from me. Thank you all for attending, and we look forward to seeing you on January 12th.
See you all then.
Great. Thank you.